Hi, my name is Jason Waz. I'm a physical therapist and founder of Competitive Edge Performance in Tampa, Florida. And nobody likes to get injured. Once they come to see me for physical therapy, it's probably because they have been injured. So a couple of questions I get are, what do we need to do to prevent this type of injury? And what can I do to get better as quickly as possible? We're going to start a series of videos to go over the ins and outs of injury prevention and also what you can do to get back in the game as quickly as possible. The most common injury I see from fitness fanatics, people that like to work out, whether it's for a sport, whether it's because they like doing CrossFit, whether it's because they're a swimmer and they like working out for that. The most common thing we see as physical therapists in a sports setting is the shoulder injury. Some of the questions I ask my patients when they come in with the more nagging, prolonged, took 3 months to occur shoulder pain are one, which way do you sleep? 99% of the time, the shoulder that's bothering a person, that's that nagging, annoying pain, that's the shoulder they sleep on, that's the side they sleep on. And I kind of laugh at people. I say, you can't really sleep with one eye open to see how you're sleeping, but if you can avoid resting on that shoulder, that would really probably help decrease the inflammation that's going on in the joint. Because basically, if you sleep on the shoulder, the ball and socket is getting compressed like this. When that happens, it pinches the ball and socket together, and that's where your rotator cuff lives, and it's just causing I tell people like a steamroller just rolling over those sensitive tendons. The second thing I do is I ask them what types of workouts they like to do. Most of the time, any workout anybody does is fine. I'm totally fine with. There's just a few motions that I try to modify if they're having acute shoulder pain that's being caused by something that occurred over the course of weeks or months. A few of the more common traditional gym exercises that people used to do, not so much now that we're into functional training, but a few of the things that people still do and I still catch them doing are, for instance, a lat pull down behind the head. That just causes significant impingement and grinding of the shoulder joints. I tell people just to avoid that if that's what they're doing. Two other movements that really cause impingement and trauma to the rotator cuff are lateral raises with dumbbells, especially with any weight. Even guys that are 350 pounds and just built up, I say 10 pounds or less is what you should use for that type of movement. And the last one is an upright row, where you're just holding up on the bar and you're kind of pulling up like this. You can see the common theme where the ball and socket could just be getting pinched between a rock and a hard place, literally, and that's what causes a lot of common shoulder pain, inflammation, tendonitis, bursitis, and it could lead to a rotator cuff tear, which is one of the more common injuries that sometimes require surgery.